Welcome to the webinar for Achieving MIPS Goals with Clinical Quality Measures. My name is Mark Dabeck, and I'm one of the trainers here at Amazing Charts, and I'll be your presenter today. Today, we're going to be going over specifically the Clinical Quality Measures section in MIPS. It's one of your more complex sections, and it's actually worth the most amount. We're going to show you how we can make it easy using our new population health module. So if you have any questions today as we're going through the webinar, we're going to have a Q&A session at the end, so we're going to do our best to answer them. You can just type your questions into the chat, and we'll get to them at the end. So today we're kind of going to go over what are clinical quality measures, why they matter to you, and the steps you can take to reach and meet the MIPS goals. And then at the end, we're going to have a question and answer session. So first, what are clinical quality measures? This term has been around for a while with meaningful use, going into MIPS and PQRS. So according to CMS, CQMs are tools that help measure and track the quality of healthcare services. And it's a shift to the value-based care, which means providers need to collect and report on all the CQM data. And this data is a factor in this new program called MIPS, which is the Merit-Based Incentive Programs. So for MIPS, which is what most providers do, they have to pick 6 measures to report on from this large list of about 250 some odd measures. You have to pick 6 that best fit your practice. So why do these things matter? So CMS, they've implemented this new program called MIPS. It's the Quality Payment Incentive Programs, which rewards you actually on value and outcomes. And the idea is it's enhanced patient care, additional revenue for your practice by boosting up your Medicare reimbursements, and the idea is to get better patient communication and engagement. Now, MIPS is divided into 4 parts. And we're just going to go over this briefly. If you need more detail, you can always sign up for some one-on-one training on this. But the 4 parts are quality, which is worth the most. It's worth 50% of your total score. And it's quality of care based on 6 performance measures. That's what we're going to be focusing on today. Beyond that, it's promoting interoperability is worth 25% of your score, which focuses on interoperability and electronic engagement. Improvement activities, which is 15% of your score, and those are measures that focus on improving your practice. And the last measure, which is new to this year, is cost, which is worth 10% of your score. And the total cost of care provided, it kind of looks at your Medicare spending per beneficiary and total cost per capita. So all of these are worth a different weight, with quality being the most. So if you are going for the full boat and want to get that reimbursement rather than just avoiding a penalty, quality is really what you want to focus on. So what do you need to do to kind of make sure you meet your goals? So when you're looking at quality, the first thing you want to do is choose the right reporting structure for your practice. Now, there are 3 major reporting structures for quality. They are claims, registry, or direct via EHR. And the differences in them is claims, to report via claims, you're basically putting a G code onto your super bills that you submit for these measures. So if a patient meets the measure, you would just put a simple G code. Very similar to how you did PQRS, if you guys ever did that, but it's for all your patients, not just 20 of them. So it's a much larger reporting. The downside to claims is there's no tracking of the measures. So you can't see throughout the year how good or how bad you are actually doing. It is just, you submit the codes and you hope for the best. The second one is registry. And what a registry is a third-party company that collects the data for you. They'll go into the system. Sometimes they'll have a direct link to the EHR, or you fill out manual reports for these things. And at the end of the year, the registry will submit for you. Now, registries are nice because first, they have a wider range of CQMs to choose from, but the downside, they usually take longer to set up. You have to rely on a third party, so you're working now with another company. And sometimes these are manual, which means not only are you entering the data in the EHR, but then you have to turn around and enter the data in the registry. The last one is direct via EHR. And this is usually the one where you want to try to focus on if you can. And because it uses your EHR to actually report the measures. You would, do all your regular data collection. You'd be working with the EHR, so you have a single source of input. You have reports that allow you to track. So unlike claims, you know how you're doing throughout the year. And then it's just simple download a file and upload it. So it does make life a little bit easier. The downside to direct EHR is there's usually less CQMs to choose from. There's about 50 something of them, but still, you only have to pick 6. So most people can find the 6 within those measures. So the next thing you want to do is pick 6 measures that best fit your practice. And it's literally just going down a list. Now, what I recommend is that you guys log on to the QPP website, which is qpp.cms.org. So make sure you guys know that website. It is valuable for looking at MIPS. And you want to go through your quality section and then choose, the 6 measures that are going to work best for you. And lastly, you want to utilize a tool within your EHR to effectively track your progress. And that's where Amazing Charts just makes life a little bit easier for you now. So we're going to look at our population health CQM module and show you how we do it in AC. So I'm going to flip and show you my screen here. Give me a sec. There we go. You guys should all be seeing Amazing Charts right now. So this is the main screen of Amazing Charts. You guys are all familiar with this. I'm going to now go to Reports. And under Reports, we'll have a new option for MIPS called Clinical Quality Measures. Clicking on this will launch our AC Population Health module. And this is going to be brand new for version 10.1. And it takes a second. And it's going to jump you right to our CQM reports. And you can see the circle moving. That's the report running. So up at the top, you see your reporting structure. These are filters for you guys. It automatically runs the report for the entire year. And for 2018, 2019, and going forward, CQMs are reported for an entire year. And you can click if you need to change your dropdown. I can report for 2017, or I can make a custom report. Maybe you're using this module for some other reporting. If you're with an ACO, you can also use this. It shows your reporting period. You can filter it by tax ID, provider NPI, specialty, gender, race, age, so on and so forth. You have all these different filtering options up top. But by default, it'll run for the entire year and for the entire practice. And then down below, you see our report. And the report is really easy to read. In keeping with the Amazing Charts tradition, we try to make the reports actually easy to read. So you can look down and see all the measures that I have selected. We have a progress bar showing green if we got good progress on there, and then red if I'm not doing so well. You see your actual percentages. You can set target percentages. So for 2018, usually target percentage is 60%. We want you to set it maybe at 61. That's all customizable in the system. And then we have all our numbers here. Everything from your initial patient population, denominator, exclusions and exceptions, numerators, and this thing called outliers. And what outliers are the patients who did not meet the measures. So you got patients who are in the denominator who are not in the numerator. So you can see exactly, how many patients were included, how many patients met the measure, and how many patients did not. What's also nice about this system is you notice these numbers are a different color here. They're blue. So I can go down and specifically drill down these measures and go, hey, I got 5 people here in my denominator. I only got 1 in my numerator, and I got 4 in my outliers. Well, wow, who are my outliers? I'm going to click on this. And here we go. These are the patients I missed it with. It shows me what's the gender, who's in my denominator, are they exclusions, exceptions, here's my 1 included in the numerator, and then who are my outliers. Choose Arnold Allen's also included numerator and denominator. This specific one counts per visit. And I can filter down by selecting up top here. So I go, okay, those are my outliers. Who would hit my numerators? I can go like this and refilter. Who's completely in my patient population. I can even then break this down by patient. So if I look at Arnold Allen, this is going to pull up a little report. Now, this is a demo environment, so I'm not getting the full version, but I'll be able to pull up a patient detail and say this patient was coming in. I can see what measures they're going to be qualified for in the denominator. So I know as a provider, I need to focus on these things with this patient. If I want to go back, I simply could just go back to my measure summary. It's all link-based, very intuitive, very much like a regular website. And you can see you have all your measures. Now, the one thing that people always have questions on is, how do I meet these? Because these are sometimes very complex. Some of them are easy. Documentation of current medications in the medical record. Well, that's easy. But let's go down to something a little bit more complex. Diabetes, hemoglobin, poor control. Well, how do I meet that measure? Every single measure has this question mark next to it. And if I click on the question mark, it's actually going to open up a whole new help system for you guys. And in here, you can see exactly what the measure is. So for this, percentage of patients 18 to 75 years of age with diabetes who had a hemoglobin A1C greater than 9 during the measurement period. And it says, please note this is an inverse measure. The lower percentage indicates you're doing a better job. And it lists who are in my denominator. So what has to be done to qualify a patient in the denominator? Well, we see here they have to have, if they meet all the following criteria. Encounter, so they have one of these CPT codes on their super bill. And any one of these CPT codes would qualify them if they have a diagnosis of diabetes type 1 or type 2. And we see all the different diagnosis ICD-10 codes that qualify. There's also ICD-9s down here, but no one really uses those anymore. So we look at the ICD-10s. So if they have one from each of these, they're in the denominator. And then I can scroll down here and show you how that gets in the numerator. So patients in the denominator will be added to the numerator is either 1 or 2 is true. 1, they have an electronically received test name that contains any one of the following phrases, and the value is greater than 9. And you see all the different phrases that can come in on that test. So if you're receiving an electronic, electronic test result from Quest, LabCorp, any one of our lab interfaces, and they said something in that says A1C and it's greater than 9, it's going to be included in the numerator. Or if it's hemoglobin, or any one of these. Also, you can list A1C, maybe you guys do it in Office. The A1C result is saved in track data. Name of the track data item should include A1C. Values greater than 9 will cause the numerator to increment. We even have an image that we can show you guys. And it shows you exactly how to do it in Amazing Charts. And this really is key to understanding all of these and knowing how these things are tracked. A lot of times before, you know what you have to do, but you don't know where in Amazing Charts. This is where we make life easy for you. We show you these. Now, some other ones in here will track via even free text, like cervical cancer screening will not only track using track data like a lab interface, an imported item, but we'll also be able to pick up free text in the doctor's notes. So maybe the doctor didn't do structured data steps, but he put in the plan section that a cervical cancer screening was done. This system will pick up that free text for you, which is huge. This allows you guys to continue working the way you normally work. Doctors are used to documenting certain things. This allows you to still do that. So it's a very easy to read report. You can see it all laid out right here. At the end, when you're ready to attest, you have a quick little button to export this thing called a QRDA Cat3 file. And that's the file that CMS needs to get uploaded in order to attest for this. You can just click the export it to the desktop. You log into the QPP website, and then you would just upload it to them following their website directions. It's actually pretty easy. We do have an attestation service that helps Amazing Charts users to attest for MIPS, and we're more than happy to go in there and help you guys with this stuff. All right, so we're going to go back here. So to review, you need to pick 6 CQMs that best fit your practice. CQM data for MIPS. Participation can lead to additional revenue for your practice. And you just need to find the right tool that can work with your EHR. And for us, that will be Pop Health. It is the easiest thing. So let's do some question and answer. You can go to your webinar panel. You can type in your questions there, and I'll be more than happy to answer them for you. It's easier. It's really easy to get started in this program. It doesn't take forever to get set up and trained. We also, within this module, offer not only CQM, but also these things called patient care gaps, patient engagement, and chronic care manual, chronic care management as well. And if you want to learn more or schedule consultation, you can contact us, sales@Amazing Charts, call the number, or visit our website. The question came in, does this work with AC Care Tracker EMR correct? Yes, this does work with Care Tracker. And with Care Tracker, you guys actually have immediate access to this if you wanted to turn it on. It's already there in the program. With Amazing Charts, this is going to be active with version 10.1. So if you guys have questions, send them into the chat, and I'll be more than happy to answer them for you. While we're getting questions, also want to point out that we have a National Users Conference coming up, in a few weeks, right here in Rhode Island, where we're based. It's November 14th to the 16th. You can come on down. We'll get you some training, and you can meet staff. I'll be there for the whole session, so come on. You can sit down with me one-on-one, and we'll help you out. The question is, this report runs only if one is set up to submit CMS directly from AC, correct? Yeah, the Pop Health is used as a direct EHR submission. So you run the report, you get your Cat 5 your QRDA file, you upload it to CMS. That is direct from AC submission. It's actually the easiest easiest way to submit. It really is just uploading a file. Most people can do it. You get to the module directly from the EHR, right? Not through the QPP website. Correct. It is right in Amazing Charts. With version 10.1, you're going to go to your reports screen. So you click on your reports button on the main screen, and then you're going to click on the MIPS and then the quality measures, and that's going to launch the Pop Health module. And that will only work once you have it turned on. If you don't have it turned on, it's going to bring it to a blank page. Our practice is PCMH certified. Will this help with our MIPS quality measures? Well, congratulations, first of all, on PCMH. That is very, very, very tough, and I commend you. PCMH actually excludes you from the improvement activities reporting. You still have to do the quality stuff. So yes, Pop Health will help you with that. And I imagine it will help with PCMH, continued PCMH certification as well. What is population health? Population health is our new module that we're rolling out. It is an add-on to both Amazing Charts, Care Tracker, and DigiCharts. And what it does multiple things that looks at your entire patient population. For example, it can look at gaps of care within your practice. So you can look at your patients with diabetes, and out of those patients with diabetes, which ones have not had a hemoglobin A1C in 3 months, and get you a list of that. Not only can it do that, but it also does some patient engagement. So you can take that list of patients and then design what's called a campaign and be able to reach out electronically via text or phone calls to these patients saying, hey, you need to come in and make an appointment. So it looks at care gaps. It does patient engagement. And patient engagement is kind of like Amazing Reminders, but instead of reminding the patients that have an appointment, it sends reminders to patients who need the appointment. It also does chronic care management tracking. So you can effectively track chronic care management within the program. How much time did you spend outside of a face-to-face visit for that patient? And then run easy report at the end of the month. See how much time and what you can bill for that patient. And also does the CQMs, as you saw. So it's easy to get the quality measures and do quality tracking as well. It's a very, very, very useful module. I'm shocked on how useful it actually is. We've had it rolled out with a few practices, and question just came up, and exactly the point I was going to go to. How would I earn additional revenue for using this tool? I'll give you an example. A practice I was working at who has population health. We looked at the care gaps, and one of the care gaps was physicals. And looking at their practice and patients who needed a physical, they had 8,500 patients that needed a physical. Now, if you think a physical is, roughly, let's make it easy, $100 per physical, they had 8,500 patients who needed that physical, needed to come in for it. Now, being able to auto reach out to all 8,500 patients using an auto reminder instead of a staff person calling calling all those patients saves you man hours. Plus, you get those patients in 8,500 times $100 per patient. That's almost $1 million in revenue that specific practice was missing. So right there, you have more patients coming in for the visits they need, better care. You have more revenue coming in from those visits. And you have less man hours of reaching out to these patients. So is there a cost? Yes, we actually split all these up into modules. So for example, the CQM module that I showed you, it's $45 per month per provider. All the other modules, there's different costs associated with them. If you need more information, feel free to reach out to sales, and they can, they can kind of give you the whole breakdown. Do you have to save the data into track data? It depends on the measure. So if you're getting, so for that A1C, for example, the two ways to meet it is if you're getting electronic, if you're getting electronic labs from Quest or LabCorp, and they're sending you your A1Cs that way, that's going to count because it's going to read the electronic labs. If you're not getting electronic labs, you do have to list the A1C into track data in order for it to count. And the reason being is it has to go in as some sort of structured data for that particular measure. For that one, we can't look at free text, so you can't have something in the note that says A1C equals. You do have to list it in track data. So one of the biggest things is I'm busy. How much time will this take up? It's actually not much time for this. Running the CQM reports is actually fairly easy. You saw how quick it might run. Yours might run a little bit longer. Maybe take a minute or two to run. Your biggest thing is learning the CQMs, and actually they're not that bad. A lot of them, are free text, so it's not really, learning a whole new way. It's just learning what phrases to go in there, and you can even make templates for some of these things. So you can template the whole thing in your practice and make data entry easier for them. So it doesn't really take up a lot of time as you would think. These are some good questions. Keep them going. Again, you can always put it into the chat. What are some examples of quality measures we would need to track? Well, for that, let's go back to the module and let's show you some of them. And it all depends on your specialty. So some examples, some easy ones in there. Documentation of current medications and medical record. That's kind of a no-brainer for everyone. You guys are doing that anyways, and if you guys were going through meaningful use, this actually was a meaningful use measure. This was a core measure that just got flipped over to quality. So this is a really easy one for most people. Preventive care and screening for high blood pressure is another easy one. But really, you want to go down a list and see which ones best fit your practice. Diabetic foot exam, cervical cancer screening, breast cancer screenings are all really easy. Meningococcal, if you do vaccinations, is another easy one. A lot of these, it all depends on your practice. And some of these things, tobacco screening is another easy one. Very easy to kind of go through because you guys are doing it. But it all depends on your specialty. You really want to look down the list. Go to the QPP, look down and see which ones would best fit your practice. And again, if you need help, we do have consultation services. We have a MIPS success service that we can work on. So we're running short on time. You guys had some really good questions. We'll have someone follow up if any outstanding questions were not answered. We'll have someone follow up and reach out with those questions. If you want to schedule any sort of demo or any practice-specific consultations, please reach out to sales, sales@amazingcharts.com, or call us 866-382-5932. Select option number 2, and it'll go right to the sales voicemail. Leave a message, and we'll have one of the sales guys give you a ring. All right. And that's all the time we have for today. I want to thank everyone for attending. Again, if you have any questions, please reach out to sales. Thank you guys for attending, and I hope you guys have a great day.